I was at work one day and was continually going to the bathroom. I'm talking 2 or 3 times an hour. And I thought, well, something's not right here.
A lot of women are suffering in silence because these conditions are not conditions that they typically enjoy having a conversation about.
I would definitely recommend they talk to their primary care physician and have them refer you within the WellSpan group.
So women's health is really an umbrella term. There's a lot of different things that fall under women's health. Then take that down into subspecialization, pelvic floor disorders, and again, that's an umbrella term. So when you think about pelvic floor disorders, the large majority of them are due to women having babies. Some of it actually gets worse as they get older and they approach menopause, and the specific hormone called estrogen levels, those decrease. Some of the conditions that they experience are problems with leakage of urine or difficulty making it to the bathroom or going very often or waking up multiple times at night to urinate. Feeling a bulge in the vaginal area or pressure or discomfort is another thing that they tend to complain of. Another thing that tends to happen is they tend to get more frequent urinary tract infections than they're accustomed to. So all of those are kind of typical of what they experience as they approach this time in their life. So Anne presented with a condition called prolapse, which is a very common condition in that age group.
It not only affected my work, it affected my home life, it affected going anywhere because I always had to make sure there was a bathroom close by. So I saw my urologist, she referred me to my gynecologist. They referred me to Dr. Roberts' office.
When you come to see a specialist like me, we would oftentimes offer a range of treatment options, and there's conservative treatment options that are non-surgical. One of the typical things that we would do is talk about bladder irritants or foods and drinks that we consume that typically cause these symptoms to get worse. Or we would oftentimes recommend something called pelvic floor physical therapy. If after conservative treatment, we can then graduate to, for some conditions, using medications. And then beyond that, certain conditions are amenable to surgical intervention.
And he talked to me about 3 separate procedures that could be done. But in his opinion, the robotic procedure he thought would be best for me, easier on me with what needed to be done.
We also like to be on the cutting edge of technology. So one of those advances is robotic surgery. And we've been acknowledged as a robotic center of excellence in multiple specialties, including urogynecology and in women's health with OBGYN. Robotic surgery is really a minimally invasive tool that allows us to do surgeries and get patients back to their normal lives much sooner.
I had the surgery on January 31st, and I went home that day. I didn't even have to be hospitalized overnight because everything went so well. After that first day, I was like a totally different person. It was perfectly like I was 4 or 5 years ago, and I still am today. I am so thankful for Dr. Roberts.
What I would like to say is please come forward, engage with your primary care doctor or with your general OBGYN so that you can come to a specialist like me. Because I'll tell you, the most common thing that I hear from my patients is that they wish they had come to see me sooner because it's life-changing for them.